What are the risk factors for schizophrenia in adolescents? Have you ever wondered what might lead to schizophrenia in teenagers? Understanding the risk factors can help us support those who may be vulnerable. Schizophrenia in adolescence develops from a mix of genetic, biological, and environmental influences. Let's break down these factors to see how they contribute to the disorder. First, genetic factors play a significant role. If a teenager has family members with schizophrenia or related mental health issues, like bipolar disorder, their risk increases. This connection highlights the importance of family history in mental health. Next, let's talk about brain chemistry and structure. Changes in brain chemicals, especially neurotransmitters like dopamine and glutamate, are linked to schizophrenia. Studies using brain imaging show differences in the brains of those with the disorder, indicating it has biological roots. Pregnancy and birth complications can also heighten risk. Issues like malnutrition during pregnancy, exposure to harmful substances, low birth weight, or preterm birth can affect brain development. These factors may leave adolescents more vulnerable to mental health challenges. Another factor is immune system activation. Increased immune responses or inflammation during critical developmental periods can be associated with a higher risk of schizophrenia. This connection suggests that our body's defenses might influence mental health. Environmental stressors and trauma are significant contributors as well. Adolescents who face severe stressors, like abuse, parental loss, or social isolation, are at greater risk. The severity of these experiences often correlates with the intensity of schizophrenia symptoms later on. Substance use is another important risk factor. Using mind-altering drugs, especially cannabis, during adolescence can double the likelihood of developing schizophrenia for those already predisposed. This emphasizes the need for awareness about substance use during these formative years. Other mental health conditions can also increase risk. For example, children with attention deficit hyperactivity disorder often have a higher chance of developing schizophrenia. This may be due to shared changes in brain chemistry. Lastly, parental age can play a role. Older fathers at the time of conception have been linked to an increased risk of schizophrenia in their children. This factor adds another layer to consider when looking at risk. Recognizing these risk factors early can help in monitoring adolescents who may be at risk. Identifying warning signs and being aware of these influences allows for timely intervention. Early support can improve outcomes and lessen the severity of the disorder. Treatment and support are essential in managing symptoms and preventing complications like social isolation or substance misuse. Understanding that schizophrenia arises from multiple interacting factors helps us approach prevention and treatment more effectively. By being informed, we can better support adolescents who may be facing these challenges.